Hi friends, Saturday afternoon, we are now at Coffee Conversation. It's a special episode, Shree Shakti. It's powered by the Emerging India Forum TEIF and a tech partner, Prime Infotech Solution. Series is Shree Shakti, theme is Lifestyle Medicine and Leadership in Healthcare. We have with us our guest speaker, Rotarian, Dr. Paula Mukherjee Goel, adolescent expert, diabetologist, lifestyle disease specialist, visionary founder of Fayth Clinic, director at Juxt Healthcare Private Limited. She has over 2 decades of experience and passion for preventive care. She has dedicated her life for elevating adolescent health and lifestyle medicine. Her expertise extends to her involvement with NGOs, corporate wellness initiatives, and a holistic approach to well-being that has reshaped modern healthcare practices in Mumbai and beyond. So friends, this will be an interesting conversation, a lion having with a Rotarian. So we are at Fayth Clinic and we'll be exploring her professional and personal journey, how she has evolved over the years. So friends, I'm Lion Amir Virani, host at Coffee Conversation and a legal tech evangelist and an author of 15 books. So, Paula, welcome to today's Coffee Conversation.
Thank you so much, Amir. Thank you for inviting me, and it's a pleasure and an honor to be here with you.
Thank you. So, Paula, you must be aware of the 2 rounds, professional, personal, but there is a surprise rapid fire round.
Okay.
So, for that, you have to be witty, fun, and quick, and you will get to win this book.
Wow.
Niche marketing, which will...
I'll try.
Yeah. So, So, let's begin. So, Paula, my first question for your professional journey round, how has your journey shaped?
I think it's been a fantastic journey. A lot of learnings, a lot of things which have come along the way. And I started off after residency in the Bombay Municipal Corporation. And I worked over there for 14 years as a medical officer, working in the slums and going to the slums and vaccination and so many things which we did. And then after that, for the last 16 years, I'm running my own organization. And I think it's been a very fantastic journey with a lot of learnings. So if I look back on my life, I couldn't have asked for anything less. I've got so much, I must say.
Yeah, we'll be discovering all aspects of your life during the conversation. So, So what inspired you to start Fayth Clinic? My first question will be for this round. And how has it evolved over the years? And how did this name came up? Because the naming, Fayth.
Yes, that's very interesting.
Very interesting.
Very interesting.
There is some story behind this naming.
Yes,
so let's hear it.
So in 2008, as I told you before, I was working for Bombay Municipal Corporation for almost 14 years. I was sort of at a dead end. And even though I was working, I was trying to make, my life, whatever it was going. During that period, I did a lot of my academic pursuits also I covered. I landed up doing my diabetology and I landed up doing adolescent medicine. But somewhere I felt that I had to branch out on my own. And it was my family who pushed me, especially my son. He was about 13 years old at that time. And he said, Mom, if you need to start off, you need to start off now. Though I personally feel he wanted me out of the space. At that time, like you have a teenager and the mom hovering around, mom becomes busy, your life is better. Yeah. So that was also one of the reasons. And we used to travel a lot to Europe. And we saw a lot of healthcare establishments over there. And we realized that what occurs in India is either you have a polyclinic or you have a diagnostic center. But the idea is not a polyclinic or a diagnostic center. The idea is when a patient comes, the patient must get everything, It has to be under one banner. So if a person comes in over here, you will be attended by the doctor, the investigations are in the house, you will get a counselor, you will get your nutritionist. So everything becomes in-house excepting your admissions. So if you look at it, so almost about 80 to 85% of the patients which are there are actually on OPD treatment basis, and about 10 to 15% of the patients will require IPD care. That's why, we've got a big setup over here. We could have converted it into a hospital, but we chose to keep it as a OPD setup.
That's interesting.
Now, coming to your question, why did we call it Fayth?
Yeah.
So, primarily, if you see, a lot of people nowadays have very less trust in healthcare. So, you see many times people say all sorts of things about doctors. Doctors are doing this or that, or looting people, or doing many things. And the idea was to get people to have the faith and the trust. So, if you see closely, the answer lies in the question. Faith with a Y. Why faith? Why faith? Because you need to have faith and trust to wherever you go for your, for your healthcare needs. Because if you believe that, your doctor is giving you good service, and the doctor will also feel motivated to give you good service. So that's the reason.
Yeah. I'll be, since this is a Christmas month, so I'll be having to make questions in a personal round. Yesterday I was seeing this Netflix film, Mary, the birth of Lord Jesus.
Yes.
Very interesting how the birth happened.
Right.
So Son of God also had to go through a lot of challenges to come into the world.
Yes.
So beautifully moved. That is depicted in the movie. So that is another. We'll come in that round. So now, what are the main challenges in diagnosing and managing lifestyle diseases, according to you?
So the main problem becomes, so if you see, lifestyle diseases or non-communicable diseases in medical language as they are called, are basically silent killers. They are not identified very easily. So most of the time people feel that they are healthy and they are leading a good life, but it's not that. And if you realize that many of these diseases start very early, it starts as early as maybe in your childhood days, in terms of unhealthy way of living and eating, and a lot of lifestyle measures which are not followed. So the primary 5 functions of lifestyle medicine includes your healthy nutrition, physical activity, sleep, positive psychology, and mental health. These are the 5 pillars on which lifestyle medicine stands on. So most of the time, if you see, people will eat healthy, or they have certain norms, okay, like in a country like India, you have so many festivals. So the idea is, okay, now we will, in festival season, food is going to be, heavy. But it's not supposed to be like that. You can still have good food and healthy food. Similarly, physical activity, a lot of people do. But what about sleep? Most of the people are sleep deprived, right? How many hours do you sleep, Amir?
8 hours.
8
Go to
hours,
Netflix.
sure. So every age group, right from newborn to adulthood, there are different hours in which the child or this thing has to sleep with. Then positive psychology. It's very easy to get yourself into that negative frame of mind. And once you do, again, it becomes very difficult. So these are some of the challenges. And mental health. See, depression. It has been found that almost 14% of the adolescents, they suffer from mental health issues. And most of the mental health issues also start at about, at a very young age, about 14 years of age. So when this occurs and it is not diagnosed over a period of time, that's where all these problems you see, heart attacks or cardiac problems occurring at in early 20s, 25, 24 years of age. I have patients who are diabetics, type 2 diabetes, not type 1, okay, who are 12 years and 13 years old. So we are seeing this trend at a very young age.
So now, Paula, your Fayth Clinic emphasizes preventive care. So how do you approach this in your daily practice?
So in a daily practice, let's say if a person comes to us for, let me put it in a very simple way. If a mother gets a child, or even if an adult walks in for a general problem, let's say cough, cold, fever or whatever. But we try to at that point of time also, counsel them, because a lot of respiratory problems are also actually lifestyle disease measures, asthma, hyperreactive airway disease. And that is a time when you need to counsel them on the different, in most of Hindu houses, if you see, we put the dhoop or the agarbatti. So that's also another irritant which comes up, and it causes a lot of problems, respiratory problems. Then there are situations where the food which is made in the house, like that has got, like you will say ki we are eating healthy, but we are adding ghee. Ghee is homemade, but ghee is saturated fat, right? And if you're going to put dollops of ghee in your food, obviously you will end up having cardiac issues. So these are some of the things where we try to inculcate them. Then again, physical activity. Most of the women think that if they're doing household work, that is good physical activity. But no, that is the work which you are doing in the house. There is no cardiovascular exercise at that point of time. So they need to go out and walk.
Next question. Can you tell us about your experience training in adolescent health in the EU and diabetology at John Hopkins?
So that EU training was there held at Sharjah, and it was basically on development of skill training. So it was a very interesting session because we came across, it was a group which had European doctors as well as Middle Eastern doctors and Indian doctors. And there was a lot of cross learning which was there. And but at the end of it, we all realized that adolescents could be from any part of the world, but the world is a very small place, right? And is very evolving. So the problems faced are universal. Then again, for diabetology training, it was like any other means. They come up with in John Hopkins, they have a lot of training where case history becomes very important, dealing with cases, not just the theoretical aspect. So I think that was both the trainings were good trainings. Learned a lot.
Now, how does your work with the Fayth Health and Teen Care Foundation tie into your mission in healthcare?
So again, that's a foundation which we started almost 16 years back, because both my husband and myself, we were doing we still do a lot of camps, medical camps. And since we were doing camps, and most of the time we didn't even know what happened to the patients in the camps. You know, whether there was any follow-up or it was just a run-of-the-mill camp or what happened. So we decided to start our NGO, and the purpose of this NGO was for two reasons. One being that we are going to deal with the non-communicable diseases right from childhood to adulthood. And in non-communicable diseases, we deal with cardiac, diabetic, respiratory. Okay, these are our primary these things, and mental health to a certain extent. And education also is something which we support through the NGO.
Wow. I'm a little interested, Kid. What are the new types of NCDs have come into, and how healthcare industry has done to treat them?
I think the newest baby in the NCD is the NCDs which is coming up in the children and the adolescents, because that is itself a new chapter in the Indian Academy of Pediatrics, of which we did the first task force in 2012, which was, you know, the task force on adolescent and childhood obesity. And then that task force actually evolved into the chapter. So I was one of the founder members of the chapter, and we've been working on this since 2012. And we've seen that over the years, like nowadays people understand the importance of healthy food, but sleep is something which I have been pushing, and I keep on speaking in so many forums. This sleep deprivation causes so many issues, like especially sleep, if you see, is divided into two parts: REM sleep and non-REM sleep. REM sleep is your dream state, and if your REM sleep is incomplete, so or you cut off your REM sleep, so that's when all your parasomnias come up, you know, like you have a lot of sleep disorders which come up. And if your REM sleep is decreased, that's when your blood pressure spikes up, your cortisol goes up, your lipid profile goes up, your leptin goes down, and ghrelin. Ghrelin is the hunger hormone. So especially in the night, if you have teenagers or even parents, you know, if they can't sleep, they get up and start watching mobile. So the blue light from the mobile, it hits your eyes and it suppresses melatonin. Melatonin is the sleep hormone. Now, if that is suppressed, you cannot sleep. And that again puts a spike in ghrelin. So the incidence of chances of going and attacking the fridge and having cookies, cakes, and all these high carb thing is very high in the night. So all this gives rise to all your obesity and multiple problems. So this is something which which needs to be tackled. And most of the time we realize that when parents come, they come to us when the problem has gone here.
Yeah.
Till they can breathe, till here, nobody comes. If they are here, then that is the time they come. And if you have to change, the entire family has to change. It cannot be only the child.
Very true, very true. Because of this quick commerce, Swiggy, Zomato, Netflix, all these things, lifestyle has
COVID made
the first
misery for everybody.
Yeah, it changed the habits and the styles, everything.
Yeah, and parents were frustrated. No, they could not deal with the children, so they gave them money. The child is ordering. Who wants to eat home food then? So that's why from our NCDPA, which is the non-communicable disease chapter of pediatrics, we try to inculcate a lot of these, seminars and webinars for general public also to identify how they can improve.
So what do you think, because children are most of the time spending in the school. So have you started anything because the teachers will be the first where these kind of changes can be brought along with the PTA or because this is, as you said, full family has to change.
Right.
So what is your thought on this?
So we have started, actually we run a very good school health program, and we started this about 8 years back. And some of the schools we run it on a regular basis. And one of the schools in particular who have been very, very cooperative is NMT Academy in Tardeo. Their trustee in the school has been very accommodative. They have made changes in their school canteen. The children have become much better and healthier. But even in spite of that, the school putting in efforts, the family also needs to get. So generally after we do the entire medicals, we identify the children who come under high risk and low risk. And we call the parents for the high risk, and we try to inform the mothers what they need to do so that they can bring about the changes in the family as well.
That's a good initiative. So keep doing that. Now let's come to this question. With Fayth Clinic receiving NABH and ISO 9001 and 2015 accreditation, what quality standards do you find essential in healthcare?
See, in healthcare, quality is very important. Most of the time, people try to push behind quantity, the number of patients kitne dekh rahe ho. That is very important too, because the more people you are able to service, the better it is for the community. But you cannot service people without maintaining quality. So quality becomes a prime and important thing. And the NABH is the accrediting body which comes and checks up everything. And we run our blood tests and all the lab parameters, pathology is done by ICAS control. So all our samples are sent to CMC Vellore. And after going over there, they are checked over there, and they also send the samples over here, and that's how the cross-checking is done to see. You must have heard about Christian Medical College, Vellore. It's a very famous institute. So they have institutes where they do the cross-checking of the samples. And even for all the diagnostic tests, the other diagnostic tests, there is a standardization which is there.
So what message we will want to give to young doctors setting up clinics or hospitals for going for this kind of accreditation? Why is it very important?
I think you must maintain accreditation because for one, you will become more careful yourself. So because you know that if you do not go within the grid of what is laid out for you, you will lose the accreditation. And if you lose the accreditation, that means there is always a chance of slipping in terms of quality. Then again, maintaining cleanliness is a very important factor. In healthcare, because of the number of the patient load, sometimes it's easy to slip, so it's very important to maintain cleanliness, to maintain hygiene, to maintain your quality standards, to maintain that, the things are in the proper format and the way it has to be done. So I think people should go in for accreditation.
Thank you. So now let's go to your role of corporate wellness in modern healthcare. How Fayth Clinic integrates it?
So with the companies and the corporates, we put them across as a package form, as a holistic healthcare. So most of the time you will find that corporate packages, wellness packages includes a annual health checkup. So ours is not a typical annual health checkup. It is a very, very individualized this thing, because we also have a certain screening questionnaire for the NCDs, because we specialize in this, as I told you. So we have a screening questionnaire which is there, in which we screen the individual, and whatever is the particular need of that individual, the counseling and the healthcare treatments are put accordingly. And along with this, we also do vaccination. Vaccination is also a very important part, because most of the time, if you realize that adolescent vaccines are not taken, and even in the corporate sector, people are not aware of adult vaccinations. So adult vaccination is something which is important, because it helps to prevent diseases, right? And it is important especially for people who are diabetics and who are of cardiac problems, because it prevents a lot of complications from coming up, especially the diabetic foot and retinopathy. So it helps to improve your immunity, because with vaccinations, your immunity levels are going to improve. So we do vaccinations, we do on-site camps also, and of course we take up webinars and seminars also, workshops as well.
Wow. Okay. Now let's talk about your role in dermatology and skincare.
So as I was dealing with the NCD in adolescents, I realized that a large number of them have a lot of skin issues and problems. And as a pediatrician, I was not really trained enough to deal with it. So I had enrolled for the American Academy of Aesthetic Medicine, and I got trained in that. But I did not realize when I got enrolled that they will treat you for the entire dermat sector. And in fact, they asked me a lot. This was in Dubai. Okay, so and they asked me as a pediatrician, because I was put over there with all dermats, what are you doing over here? So I said my main aim was to come and to learn for dealing with the adolescent dermat issues. Anyway, but since we learned on that, we then set up our aesthetic unit also, which we have over here, which we have a cosmetologist and dermatologist. So personally, I do not practice dermat, but yes, I can counsel and I can guide.
That's interesting. So you're covering all aspects of adolescent preventive and healthcare.
Yeah, but this is for adults as well.
Okay.
This is we do for adults also. It's not just for adolescents. We have a full-fledged adult aesthetic skin and hair care setup which is there.
Last question for your professional round. What impact did the Leadership Award in Healthcare 2.0 in Dubai have on your practice or approach?
I think that conference which I went to and where I got the award actually opened my eyes to what all is happening in the healthcare sector across the world. Because we are always sitting in our place and we are doing our work. Many times we are so much, as doctors, so much engrossed in our own work that we fail to see where the world is actually growing and growing. So it was a very good experience, and I was amazed to see the extent to which people have actually gone and taken up their healthcare. To what extent? I met people from Germany, from other parts of Europe, from Middle East, from Canada and US. It was a wonderful experience. A lot of tech involvement, a lot of involvement even in hormonal replacement therapies, and it was interesting.
Wow. So now let's go to our next round, the personal round. Understand Paula as a person. Tell us about your family and formative years, Paula.
So I came from an upper middle class family. I was convent educated from St. Mary's School and Ferguson College and BJ Medical College. I had a younger brother who was younger to me by almost 13 years, but I lost him in a tragic accident in 2008, the same year when we started off Fayth. So it was a very traumatic period. And during my growing years, there was a lot of, my father, it was not that he pushed me towards academics, but yes, academics played a very important role. My father himself was a recipient of President V.V. Giri Award. You know, in 1973, he was an excellent person. He was trained in mechanical engineering, and he used to make the spindles. And his name is even mentioned in the textbooks as the person who, revolutionized spindles in the country. And all his, he used to make the drafting machines. And India was importing drafting machines. And what he designed, that is when his drafting machines were used in Pune engineering colleges for a long time.
Wow. Okay. So Paula, what do you enjoy doing when you're not wearing your many professional hats?
So I enjoy traveling. I'm an avid traveler. My husband and myself, we are avid travelers, and we enjoy traveling. And I enjoy reading. I read a lot of fiction, non-fiction.
Okay. So let's have this conversation on these two areas. If you could travel anywhere for leisure, where would you like to go in 2025?
In 2025, oh, my bucket list is very huge, so it's very difficult to pinpoint out, but I would definitely like to travel to South America, maybe see all the Inca ruins. That's one thing. And I don't know, I have traveled to Iceland, and maybe I would like to go to Siberia.
Interesting. Okay. So, are there any books or activities you turn to for inspiration in your journey?
I think the people around us provide a lot of inspiration. My father, for one, provided a lot of inspiration. My husband provides, even my son, my mother. So the people around us, patients, they provide a lot of inspiration. And yes, I do read books. There was a time when I was reading a lot of self-help books also, especially after my brother passed away and I was very down. That was the time I resorted to a lot of self-help books. And I do meditation, I do calming techniques. And there is one particular lady, I would like to mention her, by the name of Dr. Atman Parmar. So she runs Radical Consciousness. It's a meditation group basically, and they do some amount of CBT training also in that. So that is also very helpful to, when you're in the stressful state, to actually calm yourself down and go to the point where you can approach your work from a very, very holistic and a focused point of view.
Wow, that's interesting. So, do you have a particular mentor person who has shaped your passion for medicine?
I think it's been all our teachers over the years. But yes, I would like to mention Dr. Swati Bhave. She's been my teacher for a very long time. I'm still in contact with her. Dr. Rekha Harish, she's the founder member of our NCDPA. Dr. Anil Sood, they have all shaped, and of course my colleagues are there. Dr. Shailaja, Dr. Nirmala. These were the people with whom I've worked very closely in the last. With Dr. Bhave, I think I've worked for almost now, 25, 30 years. And with these people, the other people, with the last 12 years. And yes, they have been a very cohesive group which has actually helped you to learn more.
Yes. Now, let's go to your activities at Rotary Club. What are your memories, experiences in your social work with Rotary Club?
I think Rotary Club has given me very good friends, for one, very good friends. And I joined Rotary because, as I said earlier, my husband and I used to do a lot of camps and social work. So we thought that this would be a good place to start off and get going. So yes, we did a lot of good camps like the Zugarewadi camp, the tribal area camps, and a lot of activities, and the pediatric heart care project. And there are so many projects and I'm looking forward to my next year as a president, because we have NCD as a part of the thing, childhood obesity. So I'm looking forward, where I intend to, integrate this learning, this work.
Yeah, every president has their projects of work which are very close. Like, I'm the president right now of my Lions Club chapter, and my passion or my pet project, which will be a legacy project for me during the years, is on importance of will making, will transfer, and legacy planning.
I think that's very important.
Yeah, so I've made a book also. So I'll give you this book also, which you can work in this together, organizing seminars, awareness sessions, because 10%, less than 10% Indians have made their wills.
Yeah.
So this is very important. And yes, I've done a seminar. There are a couple of seminars also lined up. I did a panel discussion with Koffee speakers. Nitin Jain was the panelist, CA Gopal Sharma, then Advocate Sanjay Rego. They had come down and I learned many things. Like people go for कि मेरा DIY will कर लूँगा. I'm an expert. And
No,
then put
no,
down.
it doesn't. Do it yourself will doesn't work.
Yeah,
I
yeah.
know it doesn't work.
One of my Lion Club member, मैंने सर में सर फोड़ दिया हूँ कि भाई I'm giving you this book, I'm taking to a lawyer कि भाई there have been lawyers who we have tied up.
Right.
He said नहीं, I'll make my own will. Well, then your legal beneficiaries, your executors, what difficulties they will face, they will curse you.
Nah.
So my tagline is जिंदगी के साथ भी जिंदगी के बाद भी खुशियाँ रहे फैमिली में.
Right.
So I'll connect with him later and tell him. So yeah. So now Paula, this is a month of Christmas. So how do you spend Christmas and what message can you give for this Christmas season?
Typically, we don't really celebrate Christmas as such. I mean, it's just meeting friends and like that. But I think the message which I would like to give everyone is be positive. Christmas is a new beginning, right? So we should always be more optimistic and look forward to new beginnings. It's always the end of the year and the beginning of the new year which comes. And with new year comes new beginnings. So new beginnings are something which I think I'm very enthusiastic about.
Wow. So now, this episode is a Shree Shakti 1 and you yourself an epitome of Shree Shakti. So what does Shree Shakti mean to you?
I think Stree Shakti, is something which is very difficult to define because a woman is a daughter, mother, wife, child, everything rolled into one. She's a nurturer, she's a carer, caregiver, and she's a friend. She can be your enemy, she can be Durga, she can be Kali, she can be everything rolled into one. But what is also important in Stree Shakti is ki family. Family is very important because how much ever you study, how much ever you do your business, how much ever you grow, if you do not have your family support, then all that is in vain. So if my husband and my son had not supported me in this venture, I would be nowhere, right? I mean, I could grow this, but at the end of the day, whom do I spend my days with? So for every Stree, there has to be, like we say, for every man there is a woman or there is another person. I think for Stree Shakti also, for any woman to go on to that path, she has to have her family who are going to be there, to be holding her, to provide support for her. My mother, my family, my in-laws, my husband, my child. So they are the ones who provide the entire support. And as women, we should also support other women. That's a primary goal which I think. So if you look at all our staff, we have almost 80% of our staff. I think we have only about 4 or 5 men. The rest are all women, that's again, and we help them out so they can confide in each other, they can get the support, they can come to me with their family issues. I can help them out in whatever way, by means of guidance or whatever way. If somebody has a problem with a child, they can get the child to the work also. So whatever it is, we try to provide support.
Okay.
So that's what I think is Stree Shakti.
That's beautiful. So from your bucket list for 2024, what, as you said, you have a long bucket list for 2025. So what didn't you complete in 2024 from your bucket list?
What did I not complete? That's a difficult question. I think I did quite a lot in 2024. I'm a hard taskmaster to myself also, not just to my team. But I think we achieved quite a lot in 2024 in terms of the work being done, in terms of growth, in terms of relationships. I think we did a lot. Maybe a few of the things which are left can be put, but I think there is nothing very specific as such.
That's good. So my last question, what legacy you would like to leave behind?
Legacy, I think it's a legacy of faith, which people should have faith in when they come. So even if I'm not there, faith has to grow. And the people, the team, my team members who are there with me, all my team members, my family, and of course our patients. That's what I think becomes important. The legacy of faith,
Beautiful.
as in faith in faith.
Yeah,
Also,
yeah, it's beautifully integrated everything. That's
and integration is very important.
Yes.
Right?
So let's have some fun. The rapid fire round. Your go-to comfort food.
My go-to comfort food. I'm not a foodie.
Okay.
I drink water, so I'm very boring.
Okay. You're a morning person or a night owl?
Morning.
Okay. Tea or coffee?
Coffee.
Let's raise.
Yeah. Yes. Should click to that.
Your favorite wellness activity?
Walking. It's very cathartic.
Yes.
Brisk walking.
Okay. One word to describe your journey.
One word to describe my journey. Learnings.
Wow. Best piece of advice you have ever received?
Keep going. Don't stop.
Your favorite color?
Two. Can I name two?
Ah, yeah.
Okay. One is red and the other is blue. So we have that in our logos also.
Okay. Your favorite movie?
My favorite movie. But I think one of the favorite. Leonardo DiCaprio. What was that?
Deception?
The Revenant. Revenant.
Yeah, he's a brilliant actor.
That Revenant was something which I cannot get it out of my.
Okay. I like this
brains.
movie Blood Diamond. That brilliantly he acted.
Yes.
So you did very well and you get to win this book.
Thank you so much.
Yeah, one moment. It has been autographed.
Thank you.
So friends, it was a lovely conversation with Rotarian Dr. Paula Mukherjee Goel. She said a lot of insights into NCD, lifestyle disease, then accreditation, maintaining quality standards for an healthcare professional. So all those healthcare professionals, please watch this episode, and for the insights she has shared, her journey which has evolved over the years, and keep learning. We have got over 250 plus episodes on a Koffee conversation show on YouTube with different subject experts and different topics. So do subscribe, and we meet with another Koffee speaker next week. We're having a panel discussion on 9th on ESG, which is very important, climate change. So we have got 3 speakers. So we end this year with a lot of insights, memories, and we meet with 2025 with a lot of actions at the Koffee Conversation show. If you want to be featured as a guest speaker, like hi Dr. Paula got invited, you visit our website, or you'll get invite through your friends, our colleagues. We will invite you over a cup of coffee to have coffee conversation. So enjoy your Sunday and keep safe. Thank you.
Thank you so much, Amir. It was wonderful, and I really appreciate you for inviting me. Just a small word which I wanted to add. May I? So I think I missed one very important criteria for every entrepreneur to have, and that is developing resilience. So, if you are having anybody who's watching this or is an entrepreneur, developing resilience and being resilient and adaptable goes a long way into who you're shaped into, I think. So thank you so much for having me here. Thank you.
Thank you.